Hello friends, welcome back to our channel. After so long time, we are going to discuss about our most important portion, that is the drug classification. I decided to discuss some important classes of drugs with you. So there are so many classes of drugs according to our body systems, and we study it one by one. So what is drug? We all know about the drug. Drug is a chemical substance or any product that have a therapeutic value or pharmacological action, or a drug or chemical that is used to treat, diagnose or prevention of any kind of disease. We can see here the content of our classification, that is there are so many classes or so many divisions of drug classification. According to this point, we study the one by one classification of drug. So our first classification of drug is the drug acting on autonomic nervous system. In that we can see here there are two drugs, that is the cholinergic drugs and anticholinergic drugs. So first one is the cholinergic drug. We also call it the cholinomimetics or parasympathomimetics. Mimic, we all know about that. What is the word of mimic? That is the doing the action of same action of particular one. Mimicry, we all know about that. So all these drugs are mimic the action of acetylcholine. So acetylcholine is our natural neurotransmitter. So there are two classes that is cholinergic agonist and anticholinesterase. In cholinergic agonist, choline esters and alkaloids are involved. Choline esters include acetylcholine, methacholine, carbachol and bithanchol, that is the esters of cholines. And the another one is the alkaloids. Alkaloids include muscarine, pilocarpine and arecholine, while the anticholinesterase divided into two parts: reversible drugs and irreversible drugs. In reversible includes carbamates and acridine. Acridine include one drug, that is the tacrine, while the carbamates include physostigmine, neostigmine, pyridostigmine, rivastigmine, edrophonium, donepezil and galantamine, while the irreversible includes carbamates and organophosphates. Carbamates contain carbaryl and propoxur, these two drugs, and the organophosphate contain deflos, ecothiopate, malathion, diazinon, tabun, serine, soman. So all these are the cholinergic drugs. The next one is our anticholinergic drugs. Anticholinergic drugs, we also call it the muscarinic antagonist or atropinic drugs or parasympatholytic drugs. Anticholinergic drugs divided into main three class, that is natural alkaloids, semi-synthetic derivatives and synthetic compounds. Natural alkaloid involves atropine and hyoscine. Hyoscine is also called as scopolamine, while the semi-synthetic derivatives are atropine methonitrate, homatropine, hyoscine butyl bromide, ipratropium bromide and tiotropium bromide. The next one is the semi-synthetic compounds that include four subclasses, that is the mydriatics, vesicoselective, anti-Parkinsonium and anti-secretory antispasmodics. Mydriatics involve cyclopentolate and tropicamide, while the vesicoselective drugs are oxybutynin, fluvoxate and tolterodine. Anti-Parkinsonium drug includes trihexyphenidyl, we also call it benzhexol, procyclidine and piperidine. The next one is the anti-secretory and antispasmodics, that again divided into two classes, that is the quaternary compounds and tertiary amines. Tertiary amines include dicyclomine, valthymate and pyrinsepine, while the quaternary compounds contain propanthelene, oxyphenonium, clidinium, etc. So this is the anticholinergic drugs, and the first of all we see the cholinergic drugs. Atropine, here's the atropine is more important, while the cholinergic include acetylcholine is the more important. Atropine is the antagonist of acetylcholine, and all these drugs are act on their receptors. These receptors are called as the cholinergic receptors, and they are classified into two types, that is nicotinic receptors and muscarinic receptors, and they are again divided into their subtypes, that is NN and NM, while the muscarinic receptors are divided into 5 classes, that is M1, M2, M3, M4 and M5. And these receptors are present in our different body parts or organs. So drugs bind to that receptors and show their pharmacological actions. I hope you understand this video, and it will be definitely help you in future for better understanding. Thank you for watching. So please like, share and subscribe our channel for more videos like this. Stay tuned. Thank you.